Hello, my name is Joel Furlong. I'm one of the infusion nurses at Pediatric Specialties out at Kaiser Roseville. On our team, on our safety presentation team, we have Deborah Springfield, our director, Cindy Hall, our charge nurse, Lisa Brown and Beatrice Chavez, our infusion nurses, and Bonnie Barnes, our medical assistant. We all know that chemotherapy poses hazards to our health. And there is evidence that there is exposure occurring even with the practices that we do have. So it's important that we learn to do proper chemotherapy precautions. Today we are going to show you how to disconnect a secondary tubing from a primary tubing after the chemo in the secondary has completed. And we have Beatrice Chavez who's going to demonstrate that for us. So the first thing you want to do is put on your PPE, and you apply your mask first, and then you apply your inner gloves. Realize that the mask, the important part is the eye cover, to protect your eyes from any splash or vapors. You go ahead and apply your inner gloves, and they should have a long enough reach that they will be underneath the cuff of the gown. The gown should be impermeable. And you connect it at the back. Then you go ahead and you apply your outer gloves. The cuff of the outer glove should go over the gown cuff. So then what you want to do is you're going to, NIOSH recommends that you flush all lines before disconnecting them thoroughly. So what Bea is doing now is she's lowering her secondary empty bag of chemo and flushing by gravity from the primary flush bag. She has gone ahead and clamped the tubing so that we don't have any spills, and she puts the bag and the tubing into a sealable plastic bag, and she gets a piece of gauze and puts it at the connection site where she's going to disconnect. The gauze is there to absorb any liquid drops at the end of the tubing, and she wiped the cap also. She'll seal the bag, being careful not to expel any air because she could be expelling chemotherapy if she does, and drops it immediately into her chemo bin. The bag should not be just laying around because it's considered contaminated. She'll go ahead and remove her outer gloves, and she will put them in a sealable plastic bag. Now she will remove her face mask, being careful not to touch her face. She will touch the hard plastic part of the face mask or face shield and place it into the sealable bag. At this point, she's going to remove her gown with the outside being rolled inward, just like you would for good infection control practice. Roll up her gown into a tight bundle and put that into the sealable plastic bag. Now she will go ahead and take her chemo mat and roll that up and place that into her sealable plastic bag. She'll seal it up, and she will also drop that immediately into the chemo bin. Now she, being careful not to touch her skin, she will remove her inner gloves outside in and drop those into the chemo bin. And now she will go and wash her hands with soap and water. We think it's important that good chemo precautions are followed because it not only protects the patient and yourself, but it protects everybody in the environment. There is good evidence that people who don't even handle chemo have been exposed. So please practice safely for all involved. Thank you.